Next, let's take a look at different refractive errors of the eye. Now, as we know, in the normal eye, the light must come, get refracted, and finally strike the correct point on the surface of the retina. But in conditions where there is inability of the light to strike the retina, it is called refractive errors. And there are three main errors that we need to know. The first one is called myopia. It is nearsightedness, and the way I remember this is myopia has less letters compared to hyperopia. So myopia means nearsightedness, and this is very important. Nearsighted people can see near sight. They see things close to them. And far-sighted people, they see things which are far away, more clearly. Now, let's take a look at a myopia patient who looks at a distant image. So the light will either be, what will happen is there's going to be the eyeball elongated. It could be the eyeball is elongated or the lens is thickened. So there's going to be excess refraction. Instead of refracting here because of the thickened eyeball or because of the thickened lens, the light will refract at a point in front of the retina. This is myopia. And the way you correct it is by a biconcave. Biconcave. Now, if you can't remember this, just look at this. The shape, it's like a cave. Bi is both sides. So that causes the light to actually disperse this way before it hits the eye, and then it deviates inside to the correct point in the retina. Next, farsightedness. In a condition where, let's say the patient tries to read a book. Now, when that happens, the light will focus at a point behind the retina. This could be due to the lens being too thin and unable to direct the light properly, converge more, or it could be because of the eyeball becoming too short. The length of the eyeball could be short. The treatment for that is biconvex lens. And finally, astigmatism. It is mainly due to a defect in the corneal membrane where it is not exactly uniform. Or it could be a defect in the lens, but most commonly it is a corneal membrane deformity. Now, let's just highlight this. So let's say light hits here. It will focus somewhere here. But if light hits here, it will focus somewhere here. It doesn't refract as much. So there is no single focal point. And that leads to a blurred image. These people, they may not realize it, but they see the images slightly blurred. The sharpness is decreased. And the treatment for this is cylindrical lenses. There's one more condition, it is called presbyopia. Now that is a physiological aging of the lens and the ciliary body. So when the lens ages, that means its elasticity has decreased. And if the ciliary body is with aging, the muscle contraction decreases. The strength of the muscle contraction decreases. So what happens is these patients will need reading glasses because the muscle contraction is needed to cause the lens to thicken. In the sense, you need to stop these suspensory ligaments from pulling the eye. If you want more details, you can watch the lecture I did on neurology, the cranial nerves, part 1. Now, so the most important part in this lecture is how these patients present. Let's say a 40 or a 50-year-old female comes to the doctor saying she is unable to read things now. She used to be able to read fine, but gradually she realizes she cannot see properly the letters. So the doctor will prescribe reading glasses. And the question can ask, what is this condition called? The answer will be presbyopia. It is a normal aging of the lens.